My name is Lorna Butler, and I'm Dean in the College of Nursing here at the University of Saskatchewan. And I also have an appointment in the International Centre for Northern Governance and Development as the coordinator for the strategic arm of health and social well-being for the North. The work that the College of Nursing is doing in the North is that we were offered an opportunity by the Northern communities to assist them with workforce planning, particularly in relation to registered nurses. In order to do that and move our nursing program into the North, we had to find a way, using technology, that we could deliver the program that has a clinical component. So how would we teach nursing students to do skills when we were actually in Saskatoon? So we were able to introduce a technological program or equipment that's referred to as remote presence telementoring or telerobotics. We are the only nursing program at the undergraduate level using remote presence telementoring as a way to deliver a nursing program. The way it works is that we use video conferencing for the theory courses, and then the clinical courses uses the remote presence. So essentially that is a robot that is on wheels that from Saskatoon we become the robot. So the prof in Saskatoon works through a laptop computer and can see the room, and they have their face becomes the face of the robot in those northern communities, and they can maneuver that robot around the clinical area through to supporting the students doing a procedure. So it has high-powered cameras that you can zoom in and see the vein in someone's arm to teach them how to start an IV. Or if you were listening to a patient's heart, then we can attach the stethoscope to the back of the robot so the professor in Saskatoon, simultaneous to the student, hears the heartbeat. We've been able to do the same thing with vision and with doing examinations of the ear. And recently, our own staff in the e-learning center worked with dentistry to create a light that would attach to the robot. So you can actually do an oral assessment of a child in Isle-à-la-Crosse or La Ronge, and the College of Dentistry is viewing exactly what the student sees. We saw the remote presence being used in a small community for service delivery in Nain, Labrador. And when we saw that, we thought that should be able to be used for teaching, which is how we happened to adapt it for our Northern program. What's critical in that is that we have helped our students understand that you as individuals from Northern Saskatchewan are leading the world in how you are learning to become a nurse and how you can then move that into service delivery. So we're educating nurses who understand that technology, which application should be in the service delivery area. So we don't have to work backwards, we can have forward thinking in how healthcare will be delivered in those northern communities which previously had no access. We would then have people who were thinking in a different way about how healthcare can be delivered. So that positions those students to be very forward thinking for the future for Northern Saskatchewan. Policies that are in place for distance education are not the policies that suit when you look at educating in a distributive model. So those cultural shifts and that different way of thinking about how you teach are huge changes and really are transformative, but we have to get them right. We did find 2 articles that were written by nurses in Tromsø in northern Norway, which we have now linked with them to look at what would that pedagogy be. Their interest, because they've been doing it longer than we have in terms of site by site, is what's the model of teaching that would help us to do that so that it's a good faculty-student relationship, faculty-student experience. And the communities, it's really important that the communities are supportive of what's happening. So in Ala Lacrosse, the first day of clinical, the community came out to see their students in their uniforms. The communities named the robots in both Ala Lacrosse and in L'Orange, which then invites the community to become part of that. Our nursing program went there because the community asked us to help them. And so our approach has been community development and community engagement, and to look at how do you measure return on engagement and not just return on investment. So those are issues that I think we need to grapple with and figure out.